Hello guys, welcome to my channel Learn by Hearts. Today I am here with the topic Pharmacology of female and male sex hormones. Now before moving on towards the topic, I would like to request you guys to like, subscribe and follow my channel for the further informative presentations and videos. Now before moving on towards the topic, I would like to discuss about what the hormone is. Now talking about the hormones. Hormones are the substance of intense biological activity that is produced by the specific cells in the body, and it is transported through the circulation to act on its target cells. The hormones regulate the body functions to bring about the programmed pattern of life events, that is usually the growth, development, metabolism, reproduction, aging, etc. And it also maintains homeostasis in the face of marked variable external and internal environment. Now moving on towards the male sex hormones, that are androgens. The testes are responsible for the male characters that are developed in the male, and the testosterone was isolated as a testicular hormone. Its structure was worked out and it was synthetically prepared by the year 1935. Testosterone is synthesized by the Leydig cells in the testes, and substance which causes development of secondary sexual character is testosterone. Now moving on towards the androgens and the related drugs, we have got androgens, anabolic steroids, anti-androgens and 5-alpha reductase inhibitors. Now moving on towards the androgens. The androgens is classified as natural and synthetic. The natural androgens are testosterone, dihydrotestosterone and androsterone, while the synthetic androgens are methyltestosterone, fluoxymesterone and mesterolone, while the anabolic steroids are methandinone, nandrolone, phenylpropionate, nandrolone, decanoate, oxymethylone and stanozolol. Now talking about the anti-androgens, the anti-androgens are cyproterone acetate, flutamide and bicalutamide, while the 5-alpha reductase are finasteride and dutasteride. Now talking about the regulation and secretion of the hormone androgens. Hormones or the androgens, here we have. Now this is the hypothalamus. The hypothalamus, in response to gonadotropin releasing hormone, will stimulate the anterior pituitary gland to produce follicle stimulating hormone and luteinizing hormone. The follicle stimulating hormone will act on the Sartori cells and the luteinizing hormone on the interstitial cells. The Sartori cells are usually responsible for the gametogenesis in the seminiferous tubules, while the interstitial cells will cause release in the testosterone hormone. This testosterone hormone is further converted into dihydrotestosterone, and this dihydrotestosterone is responsible for the formation of secondary sexual characteristics or for the development of secondary sex organs. Now this testosterone can be also converted into estradiol. Now moving on towards the regulation, we have got this testosterone. When present in the large amount, it will cause negative feedback, or it will inhibit the stimulation on the anterior pituitary as well as in the hypothalamus, and when the amount of estradiol is also increased, it will also follow negative feedback mechanism and inhibit the regulation cycle that will stimulate the anterior pituitary and the hypothalamus. Now moving on towards the action of the androgens and the androgens, that is natural and synthetic. We have got the androgens acts different in the different organs. So the first one is sex organ and the secondary sexual characters. Now The action of androgen will bring growth of genitals. Similarly, there is growth of ears, thickening of skin, larynx grows and voice will deepen, and increased physical vigor and aggressiveness, and intrauterine development of the male phenotype. In testes, it will bring about spermatogenesis and maturation of spermatozoa, and moderately large doses can cause testicular atrophy. Similarly, talking about its action on the skeletal muscles, we have got pubertal spurt, bone growth, and muscle building, especially if aided by exercise. Now talking about the erythropoiesis, it can cause increased erythropoietin production, which causes higher amount of hematocrit in the men than in the women. Now talking about its mechanism of action, the androgen will bind to the specific nuclear receptors in the target cells. Although testosterone itself is an active ligand in muscles and liver, in other tissues it must be metabolized to derivatives such as dihydrotestosterone, and testosterone is converted by 5-alpha reductase to dihydrotestosterone. From this we can understand that there are specific nuclear receptors in the target cells, and being the active testosterone, being the active ligand, it can act on the muscles and the liver easily, but it needs to be converted into dihydrotestosterone in order to be used in the other tissue. Now talking about its usage, the use of androgen is usually done in the following cases, that is testicular failure, hypopituitarism, age-related muscle wasting, and hereditary angioneurotic edema. And it is contraindicated in case of carcinoma of prostate and carcinoma of male breast, in case of liver and kidney disease, and during the pregnancy. If it is used in the pregnancy, it can cause masculinization of female fetus. And similarly, it is also contraindicated in case of coronary artery disease and congenital heart failure. Now talking about the adverse effect, in female it can cause virilization and menstrual irregularities. It can also cause acne, oligospermia. Prolonged use may also cause testicular atrophy. It can also cause precocious puberty, premature sexual behavior, and stunting of stature due to early closure of epiphysis. It can cause salt retention and edema, cholestatic jaundice, hepatic carcinoma, and gynecomastia due to the peripheral conversion of testosterone to estrogen. Now talking about another group of drug, that is anabolic steroid. The drug usually consists of nandrolone, oxymetholone, stanozolol, and methandinone. It is synthetic androgens which supposedly higher anabolic and lower androgenic activity. The side effects of these drugs are jaundice and worsen lipid profile. The use of androgen is usually done in case of catabolic states such as acute illness, severe trauma, major surgeries, and etc. It can be also used in the case of osteoporosis. Similarly, it is also used to enhance the physical activity in the athletes, which is considered illegal. That is, it is used while performing dope tests in the athletes before the competitive games, and it can also be used in case of suboptimal growth in the boys. Now anti-androgens. Now talking about the anti-androgens, it acts as an competitive inhibitors of androgens at the target cells. It acts effectively when taken orally. and it is usually effective for the prostate cancer. The anti-androgens are flutamide, bicalutamide, cripoterone acetate. Now talking about the another group of drug, that is alpha reductase inhibitor, we have got finasteride and dutasteride. Now talking about the finasteride, since the testosterone needs 5 alpha reductase for converting into dihydrotestosterone, these 5 alpha inhibitors will inhibit 5 alpha reductase, and it will prevent the conversion of testosterone into dihydrotestosterone, which is more active form, and it is usually used in case of BPS, that is benign prostate hyperplasia, along with alpha-1 blockers. The adverse effect of this drug is decreased libido, impotence, and decreased volume of ejaculate. Similarly, it can also cause gynecomastia, skin rashes, and swelling of lips. Thank you everyone for watching my videos, and don't forget to share, subscribe, and like my channel. This much for today. I will be telling you guys about another topic, that is female sex hormones.